Hello and welcome to this week's 10-Minute Q-Tip Tuesday. I'm your host, Amelia Borland, occupational therapist and owner and founder of Higher Standards Caregiver Training. Welcome to this week's 10-Minute Q-Tip Tuesday. If you are new to 10-Minute Q-Tip Tuesday, then let me give you a quick rundown of what you should expect. So, 10-Minute Q-Tip Tuesday, let's see how many times I can say that. Let's not actually. It's all about delivering 2 super valuable tips in 10 minutes for caregivers and caregiving organizations. The first tip is for caregivers specifically, and the second tip is for caregiving organizations. There's something else that you should know, though, that's really, really important. So pay attention. I'm closer. Closer. That's close enough. Okay. This is for educational purposes only, y'all. It is not a substitute for a therapeutic relationship. It's not a substitute for health or medical advice. So if anything that I say reminds you of someone who you think needs to be assessed or treated by a licensed healthcare provider, please make sure you're advocating for that person to get that appropriate assessment, as this is really and truly for educational purposes. Okay, now on to the good stuff that you are actually waiting for. Tip number 1 for caregivers. So I actually just had a wonderful conversation. This isn't what I was going to talk about, but I just had a wonderful conversation about caregiving for folks who have dementia. And it's been a while since I talked about caring for folks with dementia. So I thought I would share a tip related to that today. And I would say the number one concern that people have, the number one issue or challenge that people bring up when they're talking with me about working with folks who have dementia or caring for loved ones who have dementia is concerns over aggression, agitation, behavior, wandering, those kinds of issues, right? And of course, if you watch 10-Minute Q-Tip Tuesday, you may have seen me before talk about some of these issues. Certainly, if you've taken the dementia course at Higher Standards Caregiver Training, then you have seen it there. Then you've seen this information there as well. Kind of talking about how, one, we need to understand that these emotions that people with dementia are demonstrating are natural human emotions, right? First and foremost. And they are in the context of the experience of that person who has dementia. They're probably totally rational emotions to be having within the context of that person's experience. We talked about that before. That's not the tip for today, though. Kind of going a little bit further, though, we also need to remember that we need to be caring for people who have dementia, first and foremost, as people, and understanding that these are people who still get bored. Folks with dementia get bored just like anyone else does. So a lot of times what we can help do to help manage emotions like agitation or aggression or a desire to wander, things like that. What we can do to help manage that is we can help people who have dementia to be meaningfully occupied. We can give them something to do that is meaningful to them in that moment, right? So, and of course, what that is depends on the person. It depends on what stage of dementia they have. We want to make sure that anything that we are giving them to do is safe for that person to do. But it's really about not looking at this person as a diagnosis, as a disease, but looking at them as this individual who is in front of you and asking yourself the questions: what did this person do for a living? What did they enjoy doing with their time? What kind of hobbies and interests did they have before they had dementia? And how can I help to bring that kind of meaning and that quality into their experience now by trying to find a way to allow them to to experience or participate in some of those activities again. Of course, understanding that people can't always go out and do the same things that they did before they had dementia. But how can we understand that person as an individual in their interest and their experience, and give them something to do that is going to be interesting to them at whatever level they're at, to help keep them meaningfully occupied so that they're having fewer issues with agitation, aggression. So they're not wanting to get up and wander and go find something. Because people with dementia are first and foremost people, right? That's why we use people first language, because these are people who are experiencing their lives, who are experiencing their emotions just within a different context than you and I might be experiencing their lives and emotions, but they still have the same needs. Okay, so hopefully I didn't get too rambly there. I feel like I got a little rambly. Sorry, guys. On to the second tip for today's 10-minute 2-tip Tuesday. And what I want to talk about for the next few 10-minute 2-tip Tuesdays. So for a lot of June and July, we were talking about building a safety culture in caregiving organizations. For the next few 10-minute 2-tip Tuesdays, we're going to be talking about documentation. All right. So the tip that I want to share for caregiving organizations today about documentation, this is so important. This is something every healthcare provider on earth knows. All right. If it's not documented, it didn't happen. That is really important to keep in mind if you are a leader in a non-medical care organization, just as important as it is for healthcare providers to know. And there are two big reasons for you to understand this. One, so what does this mean? It means, one, your caregivers need to understand how to document. They need to be trained in how to document the care that they're providing. Because if they don't understand how to properly document the care they're providing, and trust me, it's easier said than done. I have trained a number of healthcare providers at the graduate level to document, and it's one of the hardest things for them to do. It's something that they struggle with. Even doctors struggle with this. So your caregivers in a non-medical caregiving organization may understandably struggle with how to document properly. It's just as essential that the care that they are providing is documented properly as for any other kind of care provision, because that is a record of whether or not your organization has done all of the things that it needs to do, right? It's also a record of when things go wrong, what went wrong, why it went wrong. You know, there are there are more reasons than I can list here why it's so important to keep this in mind, this concept of it. If it's not documented, it didn't happen. And we want things documented so that we know, so that we can prove that the kind of care we promised to provide was actually provided. On the flip side of that, thinking about documentation for your training. So on one hand, I talked about your caregivers need to be trained to document, right? But you also need to have documented all of the training that you are providing to your caregivers, because if that training that you provided isn't documented, then it may as well not have happened, right? From a liability perspective, from a legal perspective, you must have the training that you're providing to caregivers documented so that you can prove it's been done. That's the only way. We can't go based on hearsay. We can't go based on, well, this is how we usually do it. When it comes down to it, the only way that you can prove something happened is if it's documented. So it's really, really important to keep in mind when you're thinking about how you are training your caregivers as well. That's, of course, why at Higher Standards Caregiver Training, everything is automatically documented for our clients. We make it super, super simple and easy. Everything is constantly being tracked so that folks have peace of mind that that is being done and they don't have to worry about it. Okay, those are my tips for today. If you have questions, concerns, if you want to reach out and talk about documentation training, if you want to talk about caring for folks with dementia, if you want to talk about documentation of training, please feel free to reach out. You know where you can find me. Until next time, though, I will see you next week for 10-minute Tip Tuesday at 11 Central Standard Time. And until then, y'all, make sure that you are staying healthy, stay well, and most of all, take care. Bye, y'all.